Hey, future respiratory therapists, back at you here. We got part 4 going for you for the pulmonary function testing series. I know this is kind of a boring section. Most people like to talk about mechanical ventilation and arterial blood gases, but you got to talk about this stuff, especially for you students who are going to be going out taking your board exams. These are easy questions if you'll grasp the nuts and bolts of the pulmonary function test. Otherwise, they're extremely difficult. You're just going to miss them. You have leeway to miss multiple questions. But why miss multiple questions in a section that you can get easily if you just understand what's happening? That's the point of this video. This is part 4. Let's tie all of this together. This is spirometry with lung volumes and with diffusion capacity, all in one place. Let's figure out if this patient on the board here has an obstructive lung disease or a restrictive lung disease, and let's explain why we came to that finding. Okay, I'm glad you're here. If you like this video, be sure and like it, send me a comment, and also subscribe. I would really appreciate it. Most importantly, I appreciate comments just so I can say hi and thanks for watching. Okay, so here we go. We have multiple numbers on the board here. The numbers that are on the left are your actual values, and then we have predicted values in the middle. What we have to do is get our percentages. Now, sometimes your percentages are given for you, and if that's the case, then congratulations. You got the work done for you. But that's not the way I do things. We're going to form and we're going to figure out how to get the percentages, okay? So the first thing we need to do is get all our percentages off of these numbers. So we're going to start here with our FVC. If we want the percentage of our FVC, then we're simply going to do 1.89. Get my calculator here. We've got 189 divided by 458, and that is 41%. Now, if you remember back to the spirometry video, less than 80% was abnormal, but it did not tell you if it was obstructive or restrictive. It only told you that it was abnormal. So we know that this is abnormal. This is decreased. Okay, now we go to our FEV1. We get 89 divided by 360, and we get 25%. We also know that 80% or greater is normal, less than 80% is abnormal. So we know that this is decreased. Guess what? Still don't know if it's obstructive or restrictive. So let's just go down. Let's just systematically go through the numbers we have, and then we'll go back and ask ourselves the questions we need to ask ourselves. When we look at our volume, we have residual volume of 572 divided by 231, and that is 247%. 80 to 120 is normal, so we know that this is increased. We can look at our TLC and see that 751 divided by 641 is 117%, and this actually falls in the normal range. So we're going to see something interesting when we get to the end of this, okay? Now, continuing on, we have our DLCO here. This is corrected for hemoglobin, which is very, very important. We just talked about that in part 3. So predicted is 18.1, actual is 9.7. We know it's going to be around 50%, but let's see what the actual number is. 9.7 divided by 8 divided by 18.1, and we're going to get 52%. Again, 80 to 120 is normal. Less than 80% is abnormal. This is decreased, okay? So here's what we know right now. We have a patient with a decreased FVC, a decreased FEV1, increased volumes. Now this is important because right now you should probably be thinking, I feel like this person is going to be obstructive. I don't know for certain yet, But restrictive would give me reduced volumes. But this person has 250% residual volume. This has got to be an obstructive patient. Let's see what it is and what it works out to in the end. And then we have a decreased diffusion capacity associated with this patient in their current state. Okay? Now, how did we figure out if it was obstructive or restrictive? Go back to part 1. If you want to pause this video right now and ask yourselves, what should I be doing right now? There's 2 calculations that you should be doing to figure out specifically what the problem is here. Pause it now. When you unpause it, I'm going to go in and talk to you about what those 2 formulas were. So now that you're back, here's what we're talking about, okay? There's 2 formulas, and here they are, okay? You should have done the FEV1%, which is where you divide the FEV1 by the FVC. Now, if we do that, we will see that this patient is 0.89 divided by 1.89 has an FEV1% of 47%. Now, remember, this was important. This was the key factor in defining obstructive versus restrictive lung diseases. 47% is not good. That means that the patient exhaled 47% of their volume within the first second of a forced vital capacity. Now, we know that greater than 70% is normal. That means that somebody with a normal lung situation or a restrictive lung disease would be able to get out 70% of that volume, even if that initial volume was decreased, just like this. But that's not the case. We're less than 70%. Okay, greater than 70% is normal. We are less than 70%. And so we are looking at an obstructive lung disease. Okay, now the other thing you should have calculated is based off of video 2, part 2 of this series, is your RV to your TLC ratio. Now, if we do that, we'll see that 5.72 divided by 7.51 equals 76%. Now, remember I told you that with obstructive lung disease, you can climb above 30%. Anything above 35% is indicative of a severely acute air trapping situation. This person is acutely air trapping. This is not a chronic hyperinflation person. You know why? You know why this isn't somebody who has chronic hyperinflation? Because their total lung capacity, okay, falls within normal range. If they suffered from chronic hyperinflation, their volume, their TLC would have been greater than 120%. So this is an example of a status asthmaticus that is severely, acutely air trapping. Why? Their total lung capacity hasn't risen that much, but their residual volume, the amount of gas that they cannot get out, is massively increased, so much to the point that it makes up 76% of their total lung capacity. This is severe acute air trapping, also causing a diffusion effect, and that's where this patient is. This would be a prime example of somebody in an acute status asthmaticus episode, or maybe even pretty much just a status asthmaticus episode. Okay, so that's where that is. Now, I'm going to erase the board. Give me just a second here. I'm going to go, I'm going to erase all this, and I'm going to put some new numbers up here, okay? And we're going to go from there, okay? So we're going to erase the FEC, all this stuff. And we're going to go through another scenario so that you have a good idea and a good understanding of pulmonary function testing, okay? Now, here's our values. We have an FVC of 1.73. Now, I'm going to go through and fill in the blanks on the percentages, but as I put them up there, just start doing the numbers yourself so that when I do them, you already have them, okay? And you can check yourself. The predicted is 4.37. Our FEV1 is 1.57. Our predicted is 3.65. Our RV is 1.01. Our predicted is 1.98. Our total lung capacity actual is 2.68. And our predicted was 6.12. Our DLCO is predicted to be 18.7, and we are getting 10.6. Okay, and this is corrected for hemoglobin. All right, so here we go. Let's break this down and let's figure out what the problem might be here. Okay, now, again, let's get our percentages. If we go through the process here, and this is how you have to do this when you get these questions. I'm not doing anything here that you don't have to do. This is the way you work through these problems. My FVC, is it normal or is it decreased? What is it? Well, you got to do the math. 1.73 divided by 4.37 is 39.5%, which is 40%. That is decreased. We know the normal is 80%. When we look at FEV1, we get 1.57 divided by 3.65, and we get 43%. We know the normal is 80%, so we know that that is decreased. Okay? Again, we don't know anything right now except for the fact that this person has either an obstructive lung disease or a restrictive lung disease. All we know right now is that they're not normal. They have a defect. We just don't know which one it is yet. Okay? When we look at RV, we see that we have 1.01 divided by 1.98, and that is 51%. We know that that is decreased. Why? Because it's less than 80%. Now, right here, we probably know what the problem is, right? We probably know right now that we have a restrictive lung disease, because restrictive lung diseases give us smaller lung volumes. But there's more details to it than that to make sure that we are exactly correct. So let's figure them out. So they have a decreased RV. Now when we look at TLC, we get 2.68 divided by 6.12, and we get rounds up to 44%. Another indicator that we have a restrictive lung disease, and we're going to look into it and make sure that's right. Now when we look at our DLCO, we can already assess that it's low, obviously, and it comes in and rounds up to 57%. That's decreased also. Remember, DLCO tells you nothing about obstructive or restrictive lung diseases. They're going to be decreased with obstructive lung diseases. It's going to be decreased with restrictive lung diseases. It's going to be decreased with normal airflows that are not associated with obstructive or restrictive if you have a pulmonary capillary blood flow problem. Okay, so you don't really get much from the DLCO except for knowing that my patient's only diffusing 57% of the gas they're breathing in. Doesn't sound like a good thing, right? So that's where we go with that. Now remember, what do we do from here? Same thing we've been talking about, the same thing we did in the last one. We look at our FEV1%, which equals FEV1 divided by FVC. Well, what does that equal when we do that? If we take we take 1.57 divided by 1.73, we get 91%. So guess what? If you're watching this right now and you go, wait a second, we had 40% of our FVC, we had 43% of our FEV1, but now you're telling me we're at 91% on my FEV1%? My answer is yes. This is exactly what a restrictive lung disease looks like. Decreased volumes. They can't blow out a normal flow because they can't blow out a normal FEV1 because they can't take in enough volume to exhale their normal. So yes, their FVC is decreased, their FEV1 is decreased. But when you compare these two, you get something greater than 70%. And it means that this person, in the first 1 second of their forced exhalation, got out 91% of the volume that was in their lungs. That is not the definition of an obstructive lung disease. Obstructive lung disease cannot get that volume out. So the fact that they can get 91% out of the very little volume they were able to take in tells you it's a restrictive lung disease because these two are decreased, yet FEV1% is normal. Now, when we look at the next one that we talked about needing to be able to look at, it was RV to TLC. And so we're going to do 1.01 divided by 2.68. And what we see here is we get 37%. Okay? Now, I'm just going to tell you right now that this is a flaw in your presenter's numbers that they have presented because ideally you would not see an increase in your RV to TLC. Okay? So if I was to say that your TLC total was 2.98 and we did the math, you would get something like this. 1.01 divided by 2.98 and we would get 33%. That's less than the 35%. My point is that you don't have excessive air trapping in residual volume in regards to TLC. Okay, so I apologize for my numbers not working there exactly correctly. But my point is decreased FVC, decreased FEV1, normal FEV1%, less than 35% RV to TLC, and a decreased DLCO. And this person probably has pulmonary fibrosis. Okay? And that's where we go with that. Now, real quick, I'm going to throw a couple of numbers up here at you and show you something else. Okay? So if we erase all of this, and I'm going to keep these predicteds up here. I'm just going to change the actual percentages. So let's say that the person has an FVC of 4.32 and they have an FEV1 of 3.65 and they have an RV of 1.89 and a total lung capacity of 6.10, but their DLCO is 11.6. Okay, now when we do the numbers here, you're going to find something very, very different. Okay, 4.32 divided by 437 is 98%. This is normal. Okay, everybody agrees, right? Now when we look at 365 divided by 365, we get 100%. Again, this is normal. Okay? When we look at our RV, we get 189 divided by 198, and we get 95%. This is normal. When we look at 6.1 divided by 6.12, we get 99%. Again, normal. When we get to DLCO, we see 11.6 divided by 18.7, and we get 62%. Now, what I want to show you here is when we do our FEV1 to FVC, which you've already done twice, so I'm not going to do the formula again, we get 3.65 divided by 4.32, and we have 84%. Normal. right? That's normal. 84% is greater than 70%. So 84% of the volume came out in the first second compared to the total amount of volume forcefully exhaled. When we look at our RV to TLC, here we get 1.89 divided by 6.1. We get 30% normal. Okay? So nothing abnormal happening here. Okay? But look at what we get here. This is what I want to drive home to you real quick, and I hope you've stuck around with me until this point, because if not, you're going to miss something big. Because you're going to see this, and you're going to try to make up a disease process that doesn't exist, okay? This person does not have an obstructive lung disease because all of their air is coming out, 84% of it in the first second, and their lung volumes are not increased. So we don't have chronic air trapping. There's no evidence of that. This person also doesn't have a restrictive disease because all of our volumes here are normal. Their volumes are within normal range. Our FVC and our FEV were in normal range. Our FEV 1% is greater than 70%. And all of this checks out good. So what's going on here? Well, the answer is you have a problem with your pulmonary blood flow at the pulmonary capillary level. This is an example of what pulmonary hypertension looks like. Okay, you got no problem with air coming in and out of the lungs, but the problem is with your pulmonary capillary blood flow, evident by this right here. Normal, 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 normal. No airflow problems, no volume problems, no obstructive disease, no restrictive disease. But this right here tells you that you have something going on with the pulmonary capillaries, and you need to figure out what it is. So if the question is A, emphysema, B, pulmonary fibrosis, C, asthma, D, pulmonary hypertension, for this patient, the answer is D, pulmonary hypertension. It's not obstructive nor restrictive. It's in the blood flow through the pulmonary capillaries. Hey guys, I hope this makes sense. I know it was a lot of tedious working through some numbers and erasing and back and forth, but I hope you stuck with me. I hope you subscribe. I hope this makes sense. And when you need help with pulmonary function testing, come back and watch these videos in this 4-part series, and hopefully breaking it down and helping prepare you for your NBRC exam. And best wishes.